during the perioperative period, such as intraoperatively during cardiac surgery, what do? Let's talk about some of the data that's out there and some of the recommendations. First off, there are no clear guidelines for how to manage this, but there are a couple thoughts and a couple points to remember. If there is clot in the appendage, do not clip or oversew the appendage with clot in it. Next, I would ask, can the left atrial appendage be visualized directly during surgery or not? During mitral valve replacement surgery, you should have direct visualization if you're opening the left atrial appendage surgically. This left atrial appendage, depending on the surgical approach, can be inverted and all the clot can be removed from it. However, if you're performing an AVR or CABG surgery and you don't have direct access to the left atrium or direct visualization, then you may not be able to do anything to the left atrial appendage, and you may just need to anticoagulate postoperatively as you would with any other patient who has appendage thrombus. Some other thoughts I want you to consider are, would you delay the case for a course of anticoagulation if the surgery can reasonably wait? Remember, these patients having cardiac surgery are at higher risk for arrhythmias such as ventricular fibrillation, ventricular tachycardia, or atrial fibrillation with a rapid ventricular rate, and may need either cardioversion or defibrillation, which is something that you must consider in a patient with left atrial appendage thrombus. There are risks to proceeding with the surgery, just like there are risks to waiting on the surgery. Something for the surgeon to consider: should the surgical strategy be altered in order to minimize manipulation of the appendage and the risk of embolic stroke? If you're doing a CABG and the plan was off pump surgery, would you consider doing it on pump? There's all factors to consider and weigh together during these cases.